Hello and welcome to the Medical Sales Podcast. I'm your host, Samuel, founder of a revolutionary medical sales training and mentorship program called the Medical Sales Career Builder, and I'm also host of the Medical Sales Podcast. In this podcast, I interview top medical sales reps and leading medical sales executives across the entire world. It doesn't matter what medical sales industry, from medical device to pharmaceutical to genetic testing and diagnostic lab, you name it, you will learn how to either break into the industry, be a top 10% performer within your role, or climb the corporate ladder. Welcome to the Medical Sales Podcast. And remember, I am a medical sales expert sharing my own opinion about this amazing industry and how it can change your life. Hello and welcome to the Medical Sales Podcast. I'm your host, Samuel, and today we have another special guest, and he goes by the name of Dr. Connelly. And this is how I'm going to label this episode, because you gotta listen. This doctor made a mouthwash. This surgeon made a mouthwash that prevents you from getting cancer. What? Exactly. So make sure you listen to this episode. This is interesting. If you've ever been interested in oral maxillofacial surgery and how to be a representative in that space, or what kind of medical sales is that, this is the episode for you. And if you've ever wondered how a mouthwash can change the game for your exposure to free radicals that cause cancer, you're going to learn here. As always, we do our best to bring you guests that are doing things differently in the medical sales space. So make sure you listen to this episode, and I really do hope you enjoy this interview. Go ahead and tell the audience, what type of surgeon are you? And give us a little bit of history on your I guess your start as a surgeon.
Sure, absolutely. So I am an oral and maxillofacial surgeon. And so to be an oral and maxillofacial surgeon, you have to be start out life as a dentist, at least in dental school. And so I did my undergrad about 50 years, not 50, but about 30 years ago at the University of Miami, where first year I was there and the last year I was there, we won the national championship in football. So
nice.
It was a good time to be a Hurricane.
Nice.
It was awesome. And then traveled to Maryland for a few years, and then went to dental school at Columbia. So I'm a native New Yorker, upstate New Yorker. So very different than New York City, Manhattan. But it was a great 4 years there, and I did. I realized in dental school there I was wanted to be an oral surgeon. And so I applied to be to different programs, and ended up going to University of California, San Francisco. And that's actually where I'm a full professor now. In the training program, I'm heavily involved in research, and so I knew I was going to get my PhD. So after dental school, went to residency. You go to medical school to get your MD, and then being a glutton for punishment, I spent another few years doing my PhD. So
wow. So wait a minute. So
I got 3 of them.
Wow. So you were a dentist first, then from a dentist you became a surgeon, and then from surgeon you became a PhD surgeon.
Yeah.
Oh man, you must be a very smart person.
Well, I know. I just don't know when to say no.
That's amazing. That is amazing. So I just want to hang out there just for a moment, because I don't think people. So everybody listening right now, they are either in medical sales, or they want to be in medical sales, or they're somehow part of medical sales. Sometimes physicians too, but I don't think people think about the rigor that you go through, so that when a medical sales professional is approaching you to talk about their product or their service or their device, they're taking some of those things into consideration. So when you went to dental school and then you became an MD, was that just an automatic transition for you? Was that did somebody plant that seed? Did you say, was that always the goal? How did that?
It's part of the training program. Training program. So it's the oral surgery program is a 6-year program.
Okay.
The first year you're an intern. The year 2 and three, you go to medical third and fourth year of medical school.
I
At least
see.
the way
I
I
see.
did it.
Okay.
Then you do a year of general surgery, and then 2 more years of oral surgery. So, yeah, you
Okay.
go through a lot of
Yeah.
training, a lot of different experiences. I mean, it's a whole journey. Um, and most of the medical sales reps I deal with, most of them are like plating reps, and they just play, and but really understand because they're involved with the programs. A lot of them, a lot of the training programs,
The
and
reps
they
are involved.
understand. Yeah, yeah. I mean, particularly the sales reps that are around like universities and
Sure.
training. They really have a good idea of what happens because they see people at every level, right? And
Sure.
so they
Sure.
see the first year, the second year, and they see the attending. So if you are a sales rep, I definitely it makes a lot of sense to at least spend some time near a training institution so you can get that flavor for what those people that you're going to be selling to
Sure.
are
Yeah.
doing. That
Yeah.
that
No, it
makes
makes
that makes
sense.
a big difference.
Absolutely. I can only imagine. Going back to the beginning of your career, or not even beginning of education, really, was was being an oral surgeon something that you wanted from your undergrad days, or did that was that a kind of a discovery?
No, that was a discovery. I went to college. Actually left high school early because I'm sick of high school, and I was from being from northern New York. I was sick of being cold, and so it didn't really matter. I did early decision to the University of Miami.
Okay.
Kind of had an
Wow.
idea that I wanted to be a doctor. That I want liked in the like the medical field. My mom was a nurse,
Okay.
so I sort of like had that keyed in. Most a lot of the a lot of some doctors I knew, not a lot. I respected, and it was just interesting. Like science was interesting to
Yeah.
me.
Yeah. Yeah. Makes sense.
Yeah,
So then, what prompted the PhD? Was that also part of the program, or was that a conscious decision after everything?
yeah. No, I mean, so right after college, I spent just about 4 years working in a laboratory at the University of Maryland, Baltimore, and so that that kind of I got a lot. I ended up getting a really good research foundation there, and so from there, you really can understand how you can look at a problem from basic science
Sure.
all the way potentially up to the clinical application,
Right.
and so it's a really unique place to be, and so I always wanted that to be part of my journey, and so I always kept research. I was always doing research, in dental school, doing research.
Okay.
I spent some time at the NIDCR doing research. So
Okay.
it was always
Always been a part of your life.
always
Yeah.
there. Yeah.
Yeah. Yeah. Okay. So when you think about your space, please talk to the audience and tell us what does it look like with your interaction with reps? Are reps with you when are they selling to you? And once they've successfully sold to you, how are you working with them?
Right. Sure. So a lot of the reps we have very long term relationships with. Some when I started residency like 20 years ago. And some of the reps that were there 20 years ago are still around,
Wow.
and that I knew when I was an intern, right? And
Okay.
so,
Yeah.
we know who they are, we know their family, they know our family, so it becomes a um, very tight relationship.
Sure.
And as time goes on, they move up the sales ladder and they, bring in their associate reps and whatnot. And so that, I mean, it becomes a friendly relationship, and usually the way we work is, it kind of depends on the level of their involvement you need on their product. Some of the longtime reps, we know their product better than they do, and so they don't really necessarily need to be in the operating room with us.
Okay.
But if it's other things that we don't have as much experience with, just using, then they're always in the operating room, standing in the corner, ready to answer a question. Just Johnny on the spot. and so that's kind of how it sort of develops. I
Sure.
mean, you
Okay.
always like, have a second set of eyes, looking and making sure the instruments are sterile,
Right.
this and
Right.
that, everything's set. We have residents for that, but it's always good to have the somebody getting your back on that level as well. Particularly when you don't have residents, it's always good.
Sure.
Oh yeah, they got that set up, or the case is going to go here. This,
Sure.
and we can see, and then then we can whenever you want, we can talk about how things are changing as
Right.
well.
No. So we'll get there. So just so everyone listening can be crystal clear on what it looks like, take us into the room. And first, doctor, can you just clarify specifically what you work on as a surgeon, and
Mhm.
then paint the picture of what the room looks like in a typical surgery?
Yeah. So, as an oral and maxillofacial surgeon, I do kind of full scope oral maxillofacial surgery, and that means in private practice, and I do some private practice. Private practice is your bread and butter, wisdom teeth and implants and things like that. And there's absolutely a big role for medical sales there, for dental implants and things like
Sure.
that. But that's in the private practice environment. But in the hospital environment, it's mostly the surgery where we're moving people's faces around,
Okay.
orthodontic surgery,
Okay.
surgery where we do temporomandibular joint reconstruction, and so there's a lot of that that we do, and a lot most of the time we have the rep for the plating system that we're using that day is
Sure.
in the room. So yeah, basically the how the case starts is the circulating nurse is there, the scrub nurse is there, anesthesiologist is there. They start out by essentially getting everything ready, the patient prepped, patient goes to sleep, usually gets intubated, and then we specifically wrap the head because we're working at the head and around the breathing tube, and go to work. And that's essentially that is so at a minimum there's the circulating nurse, the scrub nurse, anesthesiologist. A lot of times these days there's a CRNA, a certified registered anesthesiologist, or I think that's how
Sure.
they do it, is CRNA, and and then there's a surgeon, and in a case where there's residents, there's at least one or two or three residents in the room
Okay.
as well.
And is there usually an associate rep, or is it usually one or the other,
Yeah, a rep or an associate rep.
or
Yeah,
an associate rep?
yeah. Usually both of them don't come because they're covering a wide
Right. They're trying to cover that bandwidth.
area, and and if the introduction has been made and the associate rep comes around, and we know who he is, and that's great. Yeah.
Awesome. Now, when it comes to that rep, well, actually, how long are your surgeries typically? Like the typical surgery, in fact, what is the most common surgery, and how long does it normally take?
Hmm. I specialize in TMJ surgery, and so like a one side TMJ replacement is about 4 or 5 hours, 3, 4,
Okay.
5 hours, and if you do, sometimes we do both sides. That's about 8, 9 hours.
Okay. So let's think about, wow, those are long procedures. Let's think about one
Yeah.
of those procedures. What are you expecting for the rep in that span of 8 or 9 hours? Are they keeping helping you keep the room calm? Are they just there to be a resource when you ask a question? Are they doing
So I
something else
mean,
that people don't think about?
the biggest part, the biggest help is when it comes to actually putting, say, sometimes we use cutting guides, and so the knowing where to point the circulator to, oh, here's the package, and then the scrub nurse, the scrub tech takes the package, opens it, and then here's the screws, pointing out where the screws are, where the screwdriver is, because sometimes we'll get a scrub tech that is not familiar with the system,
Sure.
and they'll end up needing that advice. And rather than one of us have to kind of like take our concentration away from the patient, it's awesome to have a rep that does that, that serves that purpose, and that's great.
Awesome.
because then they'll end up teaching the scrub nurse more
Right.
about their set
Right.
and their system as well.
Right.
I'd say uh, for the vast majority of the time, it's a kind of a limited time. Most of the time, they're just hanging out on their phone because we don't need them
Right.
until that point in time. But they're always sort of paying attention. And if we need something, say we need some imaging or something like that, they're always there and very willing
Exactly.
to help out.
Yeah, yeah, and in fact, that was gonna be my next question. What does it look like? Is it they're checking in every hour? Are they're there in the room the entire time, but like you said, on their phone, just waiting to be called on?
It
What's the
kind of
normal dynamic?
depends. Sometimes they come in and out. I mean, we don't, for the most part, our reps that are with us, they sort of know when they're needed,
Sure,
just what I explained, and so, we're not going to notice if they're in the corner or not, or if they're outside the door, or even if they go for a coffee break, we're not going to notice.
sure, sure,
And it's really the critical time is, when we're putting their stuff in.
sure, sure. Makes sense. So when you think about how reps approach you, think about the first time you're meeting a rep. Give us two or three things that you love when a new rep is trying to gain your business, trying to develop a relationship. What are the things that say, you know what, I this is what I want to see?
Yeah. I mean, to me, um, I like kind of a lower key approach. I don't like to be sold on stuff, and I don't like pushy things. I don't like to see that necessarily because I might have something that I like, and if you try to push something on me, actually might be negative. Say, well, I've been using this for 5 years, and why should I, and so and I know, when you're trying to sell something, you sort of, there are sort of rules, not rules, but guidelines, kind of like don't take no for an answer, whatever it is,
Right. Mm.
is that you have to be, and I'm a pretty easygoing guy, but there are others that are not so easygoing and kind of make immediate judgments on you based on whatever. And those judgments can go forward rather than realize, I realize that my first impression is usually wrong.
Mm.
But some people don't. Some people just take their first impression and
Sure.
hold it against them forever.
Sure.
And
Sure.
so, yeah, so I like a subtle approach, just to feel the person, the surgeon out, the people out, and it's not a sprint, right? It's
Yeah.
kind of it's
So
a marathon. Yeah,
no, it makes perfect sense. But I want to get a little deeper into what that looks like because a lot of people listening right now, they want to be in medical sales, right? They've
yeah.
never had a position like this, or they're in a different type of medical sales that they're not dealing with a surgeon like yourself. So when you say subtle, when you say you want someone coming to you pushy, can you give us a little example of what that looks like?
Pushy,
No, I'm
or
saying when you say subtle and you don't want
okay,
someone
right,
pushy,
right. So
give us an example of
most
what
of the
good looks
time,
like.
I say that it's usually a pretty effective approach to come forward with something educational
Okay.
that says, our company has developed XYZ, and I just, if you want, here's a brochure or a website. You know, I, if you think it would benefit you, be happy to come back and tell you more and buy you a sandwich or whatever. And something like that, I think is usually the a successful way to go. And then on the back end, setting that up with our assistants rather than directly with us because we got other stuff to do.
Right. Right.
And so that's usually the way I see it, and most effective. Just a nice introduction. This is what we do. This is maybe the benefit that would have on you if you have a current solution. That's great. If you don't have a solution for it, then here it is.
Gotcha.
Yeah, and like I said, kind of setting things up on the back end, and not have us to worry think about that.
Sure. Sure. Think about your best rep then, and it could be one that you've known forever. It can be one that you've known
Yeah.
for a number of years. What are the top three things they do that you just love to see from all your reps on a consistent basis?
They always know what's going on. If not, they make it their absolute mission to know what's going on, and that might be with the case, with the order, with a whatever. It's like they are going to do think of nothing else until your question's answered.
Okay.
And then just being friendly. And we're not going to necessarily go out to dinner together, but just being friendly and obviously the more time you spend with someone, the more familiar you get with them. After 100 times in the OR, and you step aside and chit chat, and it's kind of like somebody. It's like a work colleague at that point.
Right, right. No, I get it. I get it. So earlier you said that in the hospital you're dealing with certain kind of reps, and then outside of the hospital in clinic you're dealing with other reps.
Yeah.
Speak to that for our audience members. What two different types of reps are you referring to?
So specifically, like dental implant reps, you would see most often in private practice. I'll say I don't know, there's something there's kind of over the last 5 years, the for whatever reason the presence of dental implant reps has decreased dramatically, and I'm not sure, maybe the implant companies don't see value or need in it,
Sure.
and maybe everybody's kind of figured it out, and
Okay.
they don't need to have somebody there sell you all the time. But that's over the last 5 years, definitely something I've noticed. Um, though that's the vast majority of reps that you really see in a private practice in an oral
Okay.
surgery setting.
Okay.
Um, for the hospital setting, yeah, it's the so we do surgeries that require plates and screws to hold bones together.
Sure.
So definitely those reps. We have reps for the TMJ replacement,
Okay.
which actually got bought by one of the plating and screwing reps. So it's
Okay.
kind of the same rep, does the same thing.
Right.
We use sometimes biologic materials, and they'll have different reps. Some of the instruments we use, like some of the saws and cutting instruments that we use, have their own reps. So, and it's all variable. Like, particularly if we have a new instrument we're using, that rep will show up 2 or 3 times, make sure we're comfortable, and then we'll be like, you don't have to come anymore. And then and so everybody's trained. Um, I would say that that's kind of the in my experience in the
The
oral
normal
surgery
setting.
world.
Sure. Sure. Okay. So let's change gears a little bit. You've been doing this for, I think, self-proclaimed 30 years. Okay.
Yeah. So I graduated residency 2007.
Okay.
I
Close
went to,
enough.
yeah,
We're
yeah,
almost there. Okay.
right, yeah, yeah.
So take us back to 2007 and think about any medical innovation that impressed you. And then fast forward to today. What has been, in your opinion, the most impressive innovation in your space?
Okay. So back then when you're just starting out, I mean, everything's new. So you kind of like just figuring out
Fair.
what your
Yeah,
role in the world is.
that's fair.
Um, um, yeah, that's a good question. I'm just trying to think what would I mean. At the time, maybe a different like plating design, not necessarily earth shattering to me or anything like that, but that would be one thing. I would hear the reps talk about plating design, things
Okay.
like that. Um, and then nothing. I was it was outside of my specialty because we do 6 months of being an anesthesiology resident, and being an anesthesiologist, and I saw a lot of stuff there that was pretty amazing,
Okay.
like particularly like neuroangiography, things like that, where they're up in the
Neuroangiography.
yeah, so where they put basically a cannula in your leg vein, and they sneak it up all the way to the vessels in your brain. So if you had a stroke, they can
Wow.
kind of clot that off, and that was very impressive. So that was kind of in the
Imagine.
beginning stages,
Okay.
and so that sort of thing. I think was the most amazing. But again, when you're just starting out, it's all kind of new. So
Right, right.
you're
I
just trying to
guess the
figure
better
out.
the better question is, what's the biggest technological innovation you've seen up until today?
I think I think virtual surgical planning,
Talk
honestly.
to us about it.
So that is so when I first started out, like say orthodontic surgery, where you rearrange a person's jaws because they're not exactly they're like say the upper jaw is too small or the lower jaw is too big. So we do surgeries where we can rearrange things. And when I was an intern, we used to do them just with on stone models. And we used to literally cut the models and glue them back together when we got them in the right orientation, and then we would make a splint, like physically make a splint on that model.
Okay.
Now we take a CT scan and we get on a Zoom call just like this with a technician on the other end who has the CT scan all set up and 3D reconstruction done. And we can he'll do the virtual surgery where he makes the virtual surgical cuts. Virtually, we'll put the bones exactly where we want.
Okay.
We'll make custom plates exactly where we want. Before we would bend in the plates at the time of surgery, so there was nothing custom about them.
Okay.
And now we plan exactly where bones go, exactly where the plates go, so we know we're putting the bones where we wanted them. And yeah, I mean that's revolutionary.
When did that innovation first come around?
Probably, time flies so fast. Maybe 4 or 5, maybe, yeah, maybe like 6, 7 years ago
Well,
or
spanning
so.
your career, it's fairly recent.
Yeah, yeah,
What
sure.
did that do for? I mean, and of course, there's data, I'm sure, but just from your opinion and what you saw, what did this do for accuracy of procedures? I mean, did it
Uh, yeah.
100% increase, 200% increase? I mean, talk to us a little bit about that.
No, I mean to me it's a 100% increase. That obviously being very ballparkish, but like when you're just say when you're doing a lower jaw surgery, before there was no real way to tell where your jaw joint was going to end up. You
Okay.
just sort of like pushed on it and hoped that it ended up kind of in the right place so that
Wow.
it didn't relapse
Sure.
when you took everything all the thing everything off.
Sure.
But now where we can put the jaw joint and make a custom plate exactly where we want it, so we
Wow.
know that jaw joint is going to end up where we wanted it.
Mhm.
Because like I said before, if it didn't, it's like you either have to redo it or accept it or
Right.
whatnot. So
Right.
that sort of thing has really changed how we can best serve the patient. Really.
That's awesome. And with the with what you just described, oh gosh, we're gonna have to edit this one. I had a question for you and I just lost it.
It's okay.
Yeah, because I wanted to actually ask. So if that's the virtual is one of the biggest surgical innovations. What has it done as far as speed of the surgery? Are surgeries faster now because of this, or it doesn't really impact that? It strictly just impacts the success of the surgery and knowing where to put things in the right place.
So I'll tell you,
Or
some surgeries are faster.
okay,
Uh, um, um, sometimes I would say it doesn't it's not doesn't necessarily because there's still a learning phase going on right now of companies um, uh, iterating their custom plates and screws, and
sure,
so as they go through those iterations, the performance or accurate or ease of use, I think, is improving, but that takes some time sometimes when the ease of use isn't so great. And then maybe the next time we give them feedback and it will be. Um, so so on that level, it's getting better. The speed is getting better. Um, on the dental implant side, what is improving speed and increasing speed is we're able to same thing virtually place implants, right?
right,
And
right,
so
right,
we take an in office CT scan, send it to a lab, and with the same thing, we go through with a technician on the other end. They're placing the implants
Wow.
where they need to be, and then at the end of our treatment planning session, they make a guide where exactly where the implants go. So the guide we now we just obviously have to drill into bone to make a hole for the implants. So the guide is exactly where we planned it, and it does increase the speed and accuracy a great deal. Similar type of thing, but and every application is a little different. But between dental implants and
Yeah,
or let's say orthodontic surgery,
that's
big
amazing.
difference.
So, what type of technician is this that's doing it on the other side? I hope you're enjoying today's episode. And I want to let you know our programs cover the entire career of a medical sales professional. From getting into the medical sales industry, to training on how to be a top performer in the medical sales industry, to masterfully navigating your career to executive level leadership. These programs are personalized and customized for your specific career and background, and trained by over 50 experts, including surgeons. Our results speak for ourselves, and we're landing positions for our candidates in less than 120 days in top medical technology companies like Stryker, Medtronic, Merck, Abbott, you name it. Would you run an Ironman race without training and a strategy? You wouldn't. So why are you trying to do the same with a medical sales position? You need training, you need a strategy, and you need to visit evolveyoursuccess.com, fill out the application, schedule some time with one of our account executives, and let's get you into the position that you've always dreamed of.
So they are, I don't know what you'll call it, somebody who knows how to run the software. and
So
so,
it's from
so
the
you
company
say,
that of whatever software you're using.
yeah, and usually it's the plating company or the company that's selling us the hardware,
Okay,
and the vast majority of the time, the rep is on that call too.
got it.
So that's another. So the rep will be there to make sure the communications intact, and nothing gets lost.
Right,
And so,
right,
so
right.
that's a kind of a new role for a rep, is
Okay,
to facilitate that virtual surgery.
okay.
And so it's a very, I guess that's pretty interesting, actually.
Yeah, no, it sounds like it. How has AI impacted any of this?
It's coming. It's coming. So there are lots of. So there's still very much, I think, a desire to have a human in the loop, no doubt. But AI manipulation of imaging, AI is going to be able to place implants.
Hmm.
They're going to be able to design custom plates. There's nothing it won't be able to do. I think technically, then it'll just be able to eventually not need the technician so much, because really what the technician's for is somebody to know how to use the planning platform.
Right, right, right,
And
right. But if
so
that can
AI
just
is going to
become
be
an
able to do
AI,
that. Yeah,
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 yeah.
and so at some point the surgeon's just going to look at it and sign off on it, kind of like the way we do now with a live technician. And I think that probably mostly will be one of the big advances. Because
Sure.
everybody's trying. I think everybody's trying to find a solution that will involve AI. Some of it is not necessary. They're just kind
Sure.
of doing it because it's AI and it's smart or whatever.
It's the
Uh,
latest thing. It's the latest
yeah,
thing.
exactly. But there are places where it really will provide value and patient benefit.
Do you see a world where a robot is doing the entire surgery without human interaction in your lifetime?
Probably not without human interaction, but they have a robot that places dental implants now.
Right, right, right,
That
right.
does it now, and um, I'm not sure the economics really works out at the moment for that.
Speak to that.
So I'm not. I honestly don't know how much the robot is, but I was probably pretty expensive. and particularly people in private practice, if something they want to scale, you can't charge too much for it. So one of the bigger advances over, like, say, the last 20 years was people went from plain radiographs to digital radiographs,
Okay.
and then digital radiographs. Then they have this machine called a cone beam CT, which kind of like more or less takes a CT scan in your office.
Okay.
So just it took 20 years for some people just to adapt that technology,
Sure.
to go from plain film to to digital. Same thing with the EMRs, electronic medical records. It's taken them a long transition. Some people are early adopters, some people takes a long time, and those are transitions. But particularly for the robots, there are people that are all for it. It doesn't matter how much it'll cost. But then, if you look at the, people looking at the economics of it, it's like, how many implants do I need to place to justify the cost of this robot?
Gotcha.
And it doesn't make sense for them me to go do this. And
Right.
is
Right.
it really better for a robot to do it than me just to do it? Right.
For for
So
for the for the individuals that see the value of the robot and want it, regardless how much it costs, what value are they holding on to? Like, what? Why are they saying this?
so I I think accuracy and speed probably. Um, But in my mind, if you're doing it virtually anyway, and you've got a guide, you're basically taking out the guide part of it, because you're going to
Sure.
do it virtually, and to be able to tell the robot what to do.
Right.
I think it's more of a people like me that have been placing implants for 20 years or whatever. It's not going to improve too much, but maybe people that are not so used to it, not that don't have the experience, might look at that and say, "Oh, this is a good solution for me," because I'm not real comfortable.
Sure. So
Particularly like
so you see it more in the wheelhouse of just the newer
I
surgeon.
think so, yeah, because and it's just like a lot of other dental AI, like radiograph software that's out there. They can look at a cavity and spot a cavity, but
Right.
that's what a dentist who's been practicing for 20 years does every day, and can, like, walk into a room and smell it. They don't need help doing that, right? So
Right.
what do they really need help with? And so, maybe new people, yeah, okay, then fine.
Gotcha.
But someone who's experienced, I don't need help with that.
Yeah.
I
No.
got it.
Good point. That's a
Yeah.
fantastic point. Okay. So this is fantastic, but I want to capture some of the things that you also do, because when you are not busy being an oral maxillofacial surgeon, you are busy being an entrepreneur, and you have what I think is the coolest mouthwash that I've ever heard of. Can you please share with our audience what I am talking about?
Absolutely. So the product's name is Gingivi. So it's Gengyve. Not the easiest name to pronounce, and the reason for that is in its origin is I don't know, maybe 5 or 6 years ago, a friend of mine from Italy, from Milan, Italy, a good friend of mine. We were talking about mouthwashes and what mouthwash we'd like to recommend to our patients. And we kind of thought for a second and go, you know what, kind of isn't a mouthwash we really like. So we did a systemic review of mouthwashes with some other people, published that. Uh, Still not really happy. And then we did another review on the adverse effects of mouthwashes, because some mouthwashes out there are really pretty kind of not so easy on your mouth
Wait a
tissue.
minute, wait a minute. We got to get into this. So
Yeah.
right now, people listen to this, and people using scope and Listerine and who knows what. What is before we even get to your amazing product, what is the problem with majority, if not all, the current mouthwashes available on the market today?
So number one is high levels of alcohol. So alcohol will kill bacteria, sure, but it also really dries out your mouth. and really promotes a pro-inflammatory environment in your tissues, right? So inflammation is when you have an infection, inflammation, you need it. But when you don't, when you're generating inflammation, like through irritation or what have you, it is not good for your general system and your local mouth, your local environment, your mouth tissues. And so alcohol is for a long time has been a primary component in mouthwash. And then the secondary, the other main actor that's in a lot of particularly newer mouthwashes are things that create free radicals. And so they use free radicals to kill the bacteria, which is kills the bacteria.
Sure.
But the problem is, free radicals also stimulate inflammation and tissue damage, right? And so they try to control it with concentration, but if you use it for long enough, the free radicals, what you're trying to fight against, you don't want free radicals running around your tissues because it'll start destroying stuff. And so having free radicals like
What's a physical, if there is one, long-term consequence of consistent free radicals and not paying attention to this? What does it manifest as?
it could increase your risk for gum disease. It could increase your risk for other gum types of lesions, and even to precancer and cancer. I mean,
Wow.
free
Wow.
radicals can produce DNA damage, right? And so that, I mean, alcohol can do that. I mean, one of the worst factors of one of predictors or risk factors of oral cancer is smoking and alcohol use. Do those
Wow.
two together, and your risk of getting oral cancer skyrockets. And
Wow.
that's because there's all these harmful free radicals and other substances running around, changing your DNA, and it's affecting your tissue, so it can't respond to changes, in the DNA, and allows these abnormal cells to proliferate and make badness, and that's
Why is everyone gonna throw away their mouthwash after they listen to this episode? My goodness. Um, this
well,
no,
I
this
don't
is
want
good.
it to
This
be.
I
I mean, because we looked and we said that's why a lot of people don't have don't a lot of people don't use mouthwash. Number one, they should. But that's why we looked and we said we need make something different and something scientifically based.
what
And
what what turned you guys on to wanting to even do this? Like what was noticed, whether it be through a patient or through a discussion? I mean, how did you come to this conclusion that hey, you know what, we got to do something about this?
yeah, so I mean, if you look at the data just for the United States, close to 60% of the population, 60% of the population have some level of gum disease, right? So that could be very mild, right at the edges where the gum tissue meets the teeth, the gingivitis, or it could be moderate to severe advanced periodontitis. And when you start to get periodontitis, you go from the mild gingivitis to advanced gum disease, where now you're starting to lose bone around your
Sure.
teeth.
Yeah.
And then losing bone around your teeth means at some point you're going to lose your teeth. And so that's 60% of the population.
Wow.
And so as a dentist and someone who wants to make an impact on people's lives, looking around, well, let's say, well, maybe making a better mouthwash would be that step, and which is why we did the work,
Got
and
it.
we looked at the ingredients you might want to put in a mouthwash, and came
Okay.
up with gingerbread.
So, free radicals, we don't want them. Alcohol, we don't want it. What else do we not want in the current available mouthwashes today?
I think there's a question about fluoride. I think
Fluoride. So,
there's yeah, because for a long time people left fluoride out of mouthwashes
okay.
for better or for worse.
Okay.
And there's only a couple on the market that have it, fluoride, and some people are very wary of it. As a dentist, trained as a dentist, like the second day you learn that fluoride is necessary and absolutely critical. And I still believe that for toothpaste. But I think it's questionable why you would necessarily need it in your mouthwash.
What? Okay,
Um, yeah,
maybe
and that's
educate us.
controversial.
What is fluoride? Okay, and this is for all of us that just don't know. What is fluoride actually doing for your teeth? Why is it good? Why is it bad?
Yeah, so two things. One, fluoride is actively killing the bacteria because of what it is. It's a negative ion. Think of like chlorine or
Sure.
that so it's actively killing the bacteria, but it also does play a role in remineralizing your teeth.
Okay.
And so no question, that's a mechanism that exists. Not like I said, I'm a pretty good big proponent of fluoride toothpaste. That's what I grew up on. That's what I was trained on. I don't think you should not use fluoride toothpaste,
Okay.
but I don't think it's as beneficial as a mouthwash.
So you want fluoride in every mouthwash. In mouthwash, you want fluoride in your mouthwash.
Oh, actually, sorry, I don't think you need fluoride in your
In the
mouthwash. I don't.
mouthwash. Okay.
Yeah, I wouldn't. I don't think it belongs in the mouthwash. Toothpaste, yes, because as you actively take away the gunk on your teeth, you want to be able to put things on the tooth surface that will help protect it, and that's one of the things fluoride does.
Okay. 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 So in the perfect world, you're buying toothpaste with fluoride in it, and you're using gingerine.
Right. Yep.
Okay. Now tell us more about gingerine. So we know that it doesn't have free radicals. We know that it does
Yep.
not contain alcohol, and we know that it does not contain fluoride. So
Yep.
now, what are the good things it does contain that make it such a special product?
Right. Absolutely. So the first thing is hyaluronic acid. And so, you've probably seen commercials of high end cosmetics these days with hyaluronic acid in them.
Yes. Yes.
Yep. And the reason why is because it actually works because we all have hyaluronic acid in our body, all over our body. It's part of our soft tissues. It's part of our joints and ligaments because it attracts water. The molecule attracts water, and it provides hydration and cushioning in where it's at, and in a reasonable amount of strength. The highest level of hyaluronic acid in your body is actually the umbilical cord because it needs to stretch, it needs to
Okay.
be soft and protect. And so that's why it works so well. That's why people put it in cosmetics because it hydrates, it protects, it promotes healing. And so it's in the mouthwash. The second thing I'd like to bring up is a molecule called pullulan.
Okay.
And this is a molecule that's actually derived from a starch. And every one of our molecules we wanted to derive from a natural environment. And actually, the chemical structure of pullulan was first derived from a fungus. And so you're like, oh, I don't want to put anything in my mouth that's a
Yeah.
fungus,
Yeah.
but
Yeah. Yeah.
it's just the chemical structure. So, you and I, we can run away from threats, but a fungus doesn't necessarily have that ability. So what they do is they produce a sticky substance on their outside to protect from bacteria and viruses and things like that.
Sure.
And that's what pullulan is. It provides a mechanism to stick to your gum tissue,
Okay.
and so start to form a physical barrier against plaque buildup, biofilm buildup. And so that's why we specifically put it in there because
Wow.
hyaluronic acid does that to a certain extent, but hyaluronic acid with pullulan does it
Sure.
really nicely and makes that physical barrier in on your both your hard and soft tissues.
Wow.
Next thing is CPC.
Okay.
That's a compound that's been around for a while, and you have to be. That's the antimicrobial compound, right? And so the trick is to pick an antimicrobial compound that one kills bacteria, but two doesn't kill anything else, right?
Okay.
Or doesn't kill your tissues. Otherwise, you might as well drink battery acid or something, right? So it makes a big difference to have something that's subtle but yet really powerful, and that's what CPC is. And it'll kill bacteria that cause cavities and gum disease very nicely, and it even kills viruses really good.
Wow.
And
Okay.
so I have a lot of patients that use it during cold and flu season
Sure.
just because of the viral protection.
Wow.
Enhance that. So,
Sure.
yeah, that's a real huge benefit. And lastly, to mention is castor oil, right?
Wow.
And
Castor
so
oil in this
turns out
month.
our moms were correct. You know that castor
Wow. That
oil,
wasn't expecting that one.
yeah,
Okay.
yeah. But it's castor oil has kind of enjoyed a resurgence in the late because the main component of castor oil is this thing called linoleic acid. And what linoleic acid it's actually very anti-inflammatory. So
Okay.
rather than a lot of the other mouthwashes producing free radicals and promoting inflammation, gingiber is actively providing anti-inflammatory component,
Wow.
and linoleic acid gets really deep into the tissues to promote that anti-inflammation. On top of that, castor oil actually kills bacteria and it actually kills fungus. So we all have
Okay.
fungus in our mouth too. We all have bacteria. We all have fungus. We
Sure.
all have viruses. It's all they're there. The idea is to make sure that we have good ones and not bad ones. But the castor oil will kill the bad candidal fungus from sometimes we have candida infections get out of control,
Hmm.
and this will help that from happening.
Wow. So I have to ask, you know, what did the combination of all of these ingredients come from just the knowledge you and your colleagues already had, or did you guys sit down and say, okay, we have to make sure it does this, we have to make sure it does that, we have to make sure it does that? How did it all come together to make gingerbean?
I think both. I think uh, the research and literature about hyaluronic acid and its benefits had been building for a few years.
Sure.
So that definitely was one molecule that popped out on us
Sure.
as being important. The polulon and we also there's another molecule called PVP to make a sort of a viscoelastic physical barrier. We sort of knew they existed, and that's sort of one characteristic we wanted. CPC has been around for 40, 50 years, and that's fine because we knew that it was not going to produce. It doesn't work by making free radicals. It works a different way to attack the membrane of the bacteria,
Sure.
and so we knew that was a good, effective antimicrobial that was not going to be harmful in that way. And then castor oil, has been around a long time, and it just what seemed like a natural fit to do some of the things we wanted it to do.
Wow. Wow. Okay. In your estimation, how many people, guessing, would you say have used this product?
So we're just now saw. So it was always the idea that my colleagues in Italy uh, 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 introduced it to Italy and Europe, and so they, at this point, 100,000 plus, kind of
Okay,
a
no, that's
guesstimate.
that's a substantial number. So
Yeah.
let's take the 100,000 plus. I mean, what happened when you first said, "Okay, this is it," as in everything we thought this could be is. What
Right.
happened? Take us there.
I mean, so the first, we knew just because we knew the product we were wanting to synergize. We knew we were onto something.
Sure.
I think it was really when we got the first clinical trial back, showing that it was equally effective to this product called chlorhexidine, which
Okay.
if you go to the oral surgeon and get a wisdom tooth extraction, they're going to give you chlorhexidine, right?
Okay.
And so it killed bacteria just as effectively as chlorhexidine does.
Okay.
Problem with chlorhexidine is that it kills bacteria, but you can only use it for 2 weeks. And so then after 2 weeks, what do? You don't have, there's
Why
nothing,
can't
you
you use it
can't use
beyond
it.
2 weeks?
Well, because it causes irritations to your mouth tissues, can cause
Okay.
ulcers,
Oh wow.
and it can give you blue teeth. And so it can change the color of your teeth to blue.
You say blue teeth like that's a common
Blue teeth.
phenomenon that's known in the dental world. What
Oh
is
yeah,
blue
I
teeth?
mean
I've never
that's
even heard of it.
yeah, yeah. It absolutely it is. it's almost standard of care to say, okay, use this mouthwash, but stop after 2 weeks.
Wow.
And so now we have a mouthwash that's just as good, and you can use it for way longer. You can use it the rest of your life. There's no reason not to.
Okay. And so what I mean, so that's the clinical piece, which is the most important and amazing results. What are consumers saying? Do they love the taste? Is it refreshing? Do they
Yeah.
notice a difference?
No, they. I mean, they love the taste. It's very, it's a subtle taste. There is medicine in it, so it's a touch medicine-y, but it's not like ooh, that was kind of gross. There's a little bit of medicine in it, but it's very smooth. It's not alcohol burny. It's not when you I don't know to this day when I try Listerine, which I don't very often.
Right.
It's like you just did a shot of
On
Jägermeister,
fire.
Yeah, yeah. You're like ooh,
Right. Right.
and then a couple years ago, I got a product from my dentist that my dentist recommended. Tasted just like pool water, and I said, you know what, that tastes like pool water. He's like, well, it kind of is.
Mm,
so,
mm, mm.
and
Okay.
then that's more of the free radical stuff, right? So
Yeah. Yeah. Yeah.
chlorine and chlorite and things like that. And so yeah, but the feedback we get is that you know what, my gums stop bleeding.
Wow.
The hygienists that give it to their patients, they love it. They love the results. Dentists, they actively, tell their patients, look, if you want to, take the next step up, level up,
Yeah. Yeah.
use
Yeah.
use use gingiva, and
Wow.
yeah.
Okay, I might have to get myself some gingiva. For those listening right now
Oh,
that are still just like I am,
yeah, I'll be
where do
happy
they
to
find?
send you some.
Right, right. Please, where can people find gingiva and get their hands on some?
Right now, we have an e-commerce store. So www.gengive, GENGYVEUSA.com, and it's made in America, in Dallas, Texas, actually.
Okay, okay.
So
That will be in the show notes, folks. That will be in the show
yeah,
notes. Okay.
and I'll have you know it's founded and owned and operated by disabled veterans. And
Wow.
so
Okay.
yeah, so I actually work. My main gig is at the San Francisco Veterans
Oh, cool.
Administration,
That's
and
very
so
cool.
yeah, so I'm lucky enough to know these vets. I'm not a vet, but my partners are.
So, you know, when you tell us everything you've shared with us in the last 10 minutes, Gingervine is easy. I mean, why wouldn't I use Gingervine? You are the expert of all experts, literally. I mean, you even have a PhD to throw on top of everything else you got going on.
Yeah,
And it's kind of like, I'm going to do this, but there's a reality of the public, what the public believes, what the public understands, and then there's a reality of educating the public on a massive scale. So talk to us
yeah,
about how is that even a challenge for you guys right now? Is that not the challenge? What is the challenge, and how are you guys doing that with the education?
yeah. No, it's a massive challenge, right? So there, you just think of the people that think they're like they're important in academics, right? So yeah, you take the most famous like brain surgeon
Hmm.
there is in the country. Do you know what his name is?
I don't.
Yeah, me neither, right? So that's
I get it.
the thing, right? Big pond, small pond, big fish. So you gotta make sure, do what you can to get eyeballs on your product, and it's just marketing. It's just nowadays social media is so nuanced that if you try to do it on your own, which I did a little bit,
Hmm.
you're not going to go anywhere. You're just going to waste your money.
Okay.
And so you very much need to partner with marketing people that know how to do that system, whether it's Meta or Google. And then that's one level. That's the e-commerce level. It doesn't even matter if you're e-commerce or not, or even if you're retail. I mean, most of us are on our phones in some
Yeah,
respect
you're absolutely right.
most of the day,
You gotta know
right?
how to
So
navigate the social media world. You
yeah,
you
you got to
nailed it.
do it. You
Hmm.
got
Hmm.
somehow, some way, you got to get some eyeballs on you. And then you have to think about your audience. Some people are going to know what you're talking about as far as a high level. Some people are going to have a very basic level. It's like, well, I kind of know I have teeth, right? So okay, you
I'm
got
supposed to
teeth.
do. I'm supposed to clean them. What do you mean?
Yeah, exactly, right. And so you have to keep that in mind when you're talking about it, say, what's attractive to a person who has a limited knowledge of dentistry. And it's hard for me because I'm a dentist and a doctor,
Uh,
and I know all this stuff. And so I don't, it's hard, it's always good to have another perspective as somebody who doesn't know as much as I do, because I'm usually the one starting the education process, but I have to
sure,
realize
sure.
that I'm not talking to me. I'm talking to somebody who's not me, right? So
Right.
that's
Where
always,
where are most of the current users coming from?
I would say, the bigger cities, because that's kind of
Is it in stores or is it only online only
it's
or
on right now. It's on online only. I mean, right now I'm talking to retailers now. But yeah, you have to. Everybody tells you have to pick and choose your retailers
yeah,
correctly,
yeah, yeah.
and we're not trying to get ahead of our skis, as they say. So, but we're online right now, doing well. But
And Europe is the one that's making most of the purchases right
I
now.
would say because they've been around longer, and we've been
Okay.
around, like, really, last couple of weeks we really stood up our store, and
Okay.
I'm just now starting to roll out the social media stuff this week.
Are you getting
Um,
sales already in the US?
oh yeah, sure,
Okay.
absolutely, and yeah, absolutely, and for a while I've been building an online following.
Okay.
Um,
What's your platform?
it's, well, LinkedIn, I think, is where I'm heaviest
Okay.
now, and
Okay.
I'm a pretty active blog writer. So I have blogs on the website that talk about a variety of different things, from jaw joint
Sure.
stuff
Sure.
to omics, to things like that. And
Yeah.
so, yeah, I even talk about quantum biology.
Yeah. That is fantastic. Look, again, I'm sold. I'm not joking. I'm ordering some ginger bean before the end of the day.
Just send
And
me your address. I will
and
send it to you. You don't,
I'm okay.
don't even,
Okay, you guys are my witness. I'm sending you my address. I'm gonna get some, and
yes,
then I will get back on this show and tell
yeah,
everybody exactly what my experience was.
absolutely.
That is fantastic. Well, Doctor, it was awesome spending time with you this afternoon and just learning all the amazing things you're doing, the wonderful career you've had, and the impact you're making with this amazing product that I can't wait to try. Is there
Yeah.
anything else you want to share with our audience?
Um, no, no, I don't think so. I think just uh, if you, I'm like a poster boy for education, right? So I'm always into learning the new things, and I think that's kind of what keeps you young. Is as I'm finding, doing the business stuff. I was never a business guy, but
Yeah,
now I'm a newbie at the
yeah,
business thing, right?
yeah,
So it
yeah,
keeps you
yeah.
kind of young, and your juices flowing.
That is awesome. Thank you for sharing that. We got one more thing to do before I let you go today, Doctor. Are you ready?
Yeah,
Okay, this is called the lightning round. I'm going to ask you 4 questions, and you have less than 10 seconds to answer each one.
got it.
First question: what is the best book you have read in the last 6 months?
Mm. I don't get much time to read. Yeah, probably like I, I'm a probably I listen. Does podcast count?
Sure. Well, we'll,
Okay,
we'll
so
allow it. We'll
all
allow it.
right, all right. So Sean Carroll is a theoretical physicist at Johns Hopkins University, and he came out with a book about quantum field theory,
Okay.
and that's probably the latest.
Okay. I take it. Did you learn something from that book, or was that just kind of like an exercise in
No,
what
it's
can
weird.
be? Or
I learned something about it, from that book. It's, as you can imagine, most people don't even know what quantum field theory
right,
is, which
right.
is fine. But yeah, it's a little hard to listen to learn about mostly math on a podcast, or not bad, but on like a book
Right.
that's done verbally. You
I
kind of
get
have to
it. I
read
get
that.
it.
Yeah.
Okay. Okay. What is the best TV show or movie you've seen in the last 6 months?
So it's a YouTube thing. Does that count?
Sure.
So I'm a big fan of History of the Universe,
Okay. With
which is a YouTube.
is that with oh my gosh, his name escapes me. The astrophysicist, right?
So it's astrophysics, but it's not. It's not with the probably the guy. There's not usually not a face on it. It's usually
Oh, I see.
about. It's
Okay.
usually a narration with
I see.
pictures
I
and
see.
movies.
Okay.
And,
So it's not who I was thinking of. Okay.
yeah,
All
yeah.
right. And then what is the best meal you've had? We want the location, the restaurant, and the item.
Okay, so this is not something I do very often at all. It's the first time I went to French Laundry in Yountville, California, the
Okay.
famous French Laundry. That was, yeah, by far the best one I've ever had in my life.
Wow. And what was the item? What's the item called?
The store, the restaurant French Laundry,
Uh-huh.
and so Thomas Keller is this famous like chef owner guy,
Okay.
and
Okay.
yeah, it was really nice.
What do we get there? What's the item?
It's like they give you like 13, 14 courses
Oh, wow. So it's
throughout
an
a time.
experience.
Yeah,
Okay.
yeah, yeah, very
Okay.
much.
Is it
Yeah, it was.
Michelin?
Oh yeah, I mean it's like
Okay.
one of the
I'm
best
going.
best
Okay.
restaurants in the country. Yeah, you got
Oh, I'm going. That's
one of
happening.
those like
Okay.
you need to start months ahead of time.
Okay. Okay. So, and I'm in California, so that's gonna happen.
Yeah.
And then last
So
but not least, what is the best experience you've had in the last 6 months?
so about a year and a half ago, we adopted two children from India. And just about 6 months ago, we finally got the last of the court procedures done and got it official in the state of
Oh, that's
California.
beautiful, man.
So
Oh,
that was probably
amen
the
to that.
best experience in the last 6 months.
Oh, thank you for sharing that one with us. Wow, that you can't top that. That is
Yeah, it was great. Yeah,
fantastic.
yeah.
Congratulations, many congratulations to you.
Thank
And
you.
again, doctor, it was awesome spending this time. We can't wait to see all the amazing things you go on to continue to do. And thank you for being on the Medical Sales Podcast.
Thank you very much. Happy to.
And that was Dr. Connelly. Wow, fantastic stuff. A mouthwash that prevents free radicals, spares us of alcohol. I mean, who knew? Who knew that the mouthwash available today is causing all this damage? You know, I always joke with my son that 50 years from now, they're going to say, can you believe they used to do this? They're going to say, can you believe they used to use this kind of mouthwash? Can you believe? I already see it happening. Long story short, though, all jokes aside, make sure you check out Gingervine. We have his information to get access to that mouthwash in the show notes. I'm gonna get some. Get yourself some. And you know what? Let's one up this. Send me at hello at Evolve Success. Send us at hello at Evolve Success your experience of using Gingervine after you order yourself some. As always, we're doing our best to bring you guests who are doing things differently. You know, this podcast is here to inform you on what really goes on in medical sales, inform you about how the business side of selling devices, drugs, services happens in healthcare. And we're able to do it because of viewers and listeners like yourself that subscribe to the podcast. So if you subscribed to this podcast, we thank you. We really appreciate it. And if you haven't, you know what you need to do. So make sure you tune in next week for another episode of the Medical Sales Podcast. I hope you enjoyed today's episode. And remember, I have a customized and personalized program that gets you into the medical technology industry as a sales professional, or any type of role for that matter. Become a top performer in your position and masterfully navigate your career to executive level leadership. Check out these programs and learn more at evolvesuccess.com by visiting our site, filling out an application, schedule some time with one of our account executives, and allowing us to get you where you need to be. Stay tuned for more awesome content with amazing interviews on the Medical Sales Podcast.